Bismillahirrahmanirrahim. So, the fascias of the neck. The fascias of the neck consist of the superficial fascia and the deep fascia. The deep fascia has further layers: the investing layer, the pretracheal layer, the prevertebral layer, and the carotid sheath. The red line demarcation shows the deep cervical fascia, and we see that this is the whole transverse section of the neck. The deep cervical fascia splits at the four corners of the neck in this transverse section, and it covers anteriorly the sternocleidomastoid muscles and posteriorly the trapezius muscles. After covering it, this is continuous throughout the neck. This is continuous. So in anywhere, if we cut the neck, and then we will face the skin, then superficial fascia, and then the deep cervical fascia from anywhere throughout the neck. Coming towards its attachments, inferiorly here it arises from superiorly, sorry, it arises here from the base of the mandible. This is the base of the mandible. From here it arises, and then it moves downward, and when it moves downward, the fascia here, it is not shown, but I am supposing it moves downward and it attaches to the hyoid bone that is lying anterior to the suprahyoid muscles. Then it moves downward from this hyoid bone and lies anterior to the infrahyoid muscle, and then this is the sternocleidomastoid muscle, so it encloses this muscle, and here it comes and attached to the manubrium of the sternum, and here it splits to form the suprasternal space. This is the splitting. We see this, that it moves downward attaching to the hyoid bone, then coming lying anterior to the infrahyoid muscle. These are the suprahyoid muscles, and then it comes down and splits and form a space. This space is called the suprasternal space. Posteriorly, it is attached to the occipital bone, the superior knuckle lines, and it moves downward, and when it moves down, it is attached to the scapula, the spinous process of the scapula, and then moves anteriorly and is attached throughout the root of the neck. From the spine of the scapula, it moves anteriorly and attaches to this acromion process and the clavicle, and then hence the manubrium. In this figure, the investing layer, it is not shown over here, but I am supposing it. The investing layer also arises from this mastoid process, and it covers the sternocleidomastoid muscle, and it also arises from the zygomatic arch. This is the zygomatic arch. From this zygomatic arch, when it arises, then it splits and it covers the whole parotid gland to form the parotid sheath, capsule of the parotid gland, and then it moves downward, and here it again attaches to the base of the mandible, as I told you previously. And from here again, when it moves down, this is the submandibular gland. It splits to cover the submandibular gland and then moves down and attaches to the hyoid bone. Now coming towards the pretracheal fascia. The pretracheal fascia, it arises from the hyoid bone. This is the hyoid bone, and it consists of two parts, a muscular part, and the muscular part, this is the pinkish one demarcation, and the muscular part covers the infrahyoid. This is hyoid, so inferior to it, the muscles are called infrahyoid muscles. It covers the infrahyoid muscles, and this is the muscular part, and a visceral part which covers the thyroid gland, and anteriorly the pharynx. And this then the pretracheal fascia will then come down, and it will fuse with the pericardium of the heart and with the aorta. Look at the pretracheal fascia over here. The pretracheal fascia is covering the thyroid gland, and this is the visceral part, and this is the muscular part, the pinkish one. These all are the infrahyoid muscles, sternocleidomastoid muscles and the infrahyoid muscles, sternohyoid, the sternothyroid, and so. And posteriorly, this the pretracheal fascia and this green color demarcated, the buccopharyngeal fascia, they fuse with each other, and therefore togetherly they enclose the esophagus and the trachea. Now coming towards this, the yellow demarcated one is the prevertebral fascia, and we see that it surrounds the whole vertebral column. This is the vertebral column, the vertebrae. The C7 vertebrae is shown over here. This yellow demarcated. It covers it. It also surrounds the muscles associated with this vertebra. The muscles like the anterior scalene and the middle and the posterior scalene, etc., and the deep cervical muscles. It covers it as a whole, and posteriorly it attaches to the spinous processes. Anteriorly it blends with carotid fascia, carotid sheath, moving like this, and anteriorly it also attaches to the it moves along the anterior longitudinal ligament. This it is shown over here, the yellow demarcated line. This fascia arises superiorly and posteriorly from the occipital bone, and anteriorly from the base of the occiput, and it moves downward. And when it moves downward, then at the level of T3, it fuses with the anterior longitudinal ligament.